Hello, my name is Dr. Susan Blank, and I'm an endocrinologist who works with the Virginia Department of Health. Thank you for joining me for this learning session, which is part of the Virginia Healthy Hearts Initiative. This learning session is part of a series we are calling Heart Healthy Hacks because it focuses on practical tips to help overcome common barriers to living a healthy lifestyle. Today, we are going to be focusing on practical tips that can help you save money because we know that cost can often be a barrier to heart healthy living. Let's get started. One of the major recommendations for eating a heart healthy diet is to increase the number of fruits and vegetables we're eating each day, with a goal of filling up half of our plate with fruits and vegetables at each meal. And a lot of people worry a lot about the cost of all these additional fruits and vegetables, but there's some good ways to get produce on a budget. The first tip is to buy fresh produce when it's in season because that's when it tends to be the most affordable and the most delicious. And there's a nice website by Virginia Grown called What's in Season. I've listed the website address here along with a QR code. This website includes a list of what's in season in Virginia on a month-by-month basis, and it's also searchable so you can find places to buy fresh local produce near you. Another tip is to buy types of fruits and vegetables that tend to be affordable year-round. A good example of this for fruits is bananas, which tend to be quite affordable. They usually only cost around 25 cents a banana. Other examples for fruits include apples and oranges, and examples for vegetables include broccoli, carrots, cucumbers, and cabbage. If the produce that you're looking for isn't in season or if it's out of your budget, it's always a good option to look for frozen or canned varieties. These tend to be more affordable and are still quite healthy. There are just a few things that you need to look out for. If you're buying frozen fruits or vegetables, you want to make sure that they're not packaged in any kind of sauce. And if you're buying canned fruits, you want to make sure that they're packaged in 100% juice, not sugary syrup. And if you're buying canned vegetables, you want to look for low sodium or no sodium added varieties, or you want to rinse those off with water in a colander before you use them. Beans, either dried or canned, and lentils can be a great inexpensive source of protein. And another good option is to buy in bulk. Buying in bulk tends to be more affordable, and then you can use that ingredient over multiple meals over the course of the week, or you can split it up and freeze some of it if you have room in your freezer. As far as food preparation and cooking, the first tip is simple. It's to cook at home. Cooking it at home tends to be a lot more affordable than eating out, and it also tends to be a lot healthier because when you cook, you have control over how much salt and sugar and fat you're putting into your food. If you don't know where to start, the American Heart Association website has a great collection of heart healthy recipes, along with videos that demonstrate cooking skills. And public libraries can also be a great resource because you can check out cookbooks to try new recipes. The next tip is to meal plan to minimize food waste. Believe it or not, the USDA estimates that around 30% of the American food supply is thrown out each year as food waste. So it's important to plan your meals to make sure that you're using up all of the ingredients that you buy, and that way you're not losing any food or money by just throwing it away in the trash can. The last recommendation is to try growing an herb garden. Herbs can be a great way to add flavor to food, especially if you're trying to cut back on salt, but they can get a little bit pricey if you're buying fresh herbs each time you need them. It's very easy to grow a little herb garden on a windowsill or out on your porch. I have a terrible time keeping plants alive, and even I can do an herb garden. You can buy herb plants at grocery stores sometimes, and you can find them also at garden stores. As far as physical activity, you don't have to join a gym or use fancy equipment to exercise. Walking is fabulous exercise, and all you really need to do it are a decent pair of walking shoes. And instead of using fancy weights at the gym, you can use your own body weight and do exercises like squats, lunges, planks, and push-ups. You can also use things that you have around your house, like soup cans or water bottles as weights if you want to lift weights. And there's a lot of great free online exercise content. The American Heart Association has a great series that you can find on YouTube, but you can look around on YouTube, on internet, or social media and find almost any kind of exercise class that you're interested in. And lastly, city recreation centers and senior centers may offer free or discounted classes, so you might want to check around and see what's available in your local area. Many people will end up needing to be on a medication at some point in their life for things like high blood pressure and high cholesterol in order to optimize their heart health. And people worry a lot about the high cost of medications, quite understandably. The important thing to do here is to work closely with your doctor and pharmacist to make sure that you're on the least expensive option for you. Generic medications tend to be the least expensive, and fortunately, a lot of the common medications that are used to support heart health are available as generics. And there are some pharmacies that have very good discounted programs for generic medications. Walmart, for example, has a program where they provide many generic medications for $4 for a 30-day supply or $10 for a 90-day supply. If the medication that you've been prescribed is not available as a generic, it's very important that you make sure that you are on the medication that's on your insurance formulary. A lot of times insurances will cover one medication in a class, but not the rest of them. So a time where you might run into this is if you get prescribed a new medication, you go to the pharmacy to pick it up and you have huge sticker shock because it's so expensive. You should ask the pharmacist and see if there might be another medication in the same class that is on your insurance formulary and may be less expensive. One thing to know about this is that unfortunately these formularies shift over time. And so another situation where you might run into this is if you've been on a medication for a while, you've been doing well, it's been affordable, and you go to the pharmacy to pick it up, and all of a sudden it's way more expensive. That may mean that your insurance formulary has changed and the medication that you're on is no longer on your formulary, but in general, there would be another medication in that same class that is on your formulary. And if you work with your doctor and pharmacist, hopefully you can get switched to that and get back on a more affordable option. It's also a good idea sometimes to compare pharmacies. Believe it or not, there can be large variations in how much different pharmacies charge for the same medication. So you can call around to ask how much different pharmacies will charge for the medication. Are there also some good online resources like GoodRx where you can type in your medication and find out which local pharmacy will offer it at the best price? There are some insurances that provide discounts for ordering a 90-day supply of long-term medications by mail order, so that's something worth looking into. And for some of the very expensive newer medications, if you're having a hard time affording them, the drug companies offer patient assistance programs. You usually have to apply for these, but they can help provide medications at a very discounted rate. Lastly, if you don't have insurance, there are still ways to get your medications. Free clinics often have pharmacies associated with them, and a lot of clinics and hospitals also offer financial assistance on a sliding scale for people who don't have insurance. This concludes today's session. Thank you very much for your time and attention. I hope you've learned some helpful tips that can help you save money while you're taking care of yourself and your heart health. If you want more information on heart disease and heart health, you can go to the VDH website. I've listed the website address here along with a QR code that will take you there. Thank you and have a wonderful day.